Good afternoon, and thank you for joining us today in our live session by Medcare. Today's session will be on a healthy lifestyle for your heart. But before I give you a brief, I just want to encourage you to ask to lifestyle. This is what we're going to discuss with the doctor and how he's going to give us tips, especially that Ramadan is in 15 days and we want to know if it's safe to fast, and if anyone with cardiac issues, can they fast, what kind of medication they should do. So we will cover up everything that you need to know about a healthy lifestyle for your heart. So how can we put together a healthy lifestyle routine and keep our heart and vessels healthy? Dr. Mohammed Fathi, specialist cardiologist at Medcare Hospital Sharjah, will answer this question. Doctor, thank you so much for being with us here and answering the questions that we receive also from the audience.
Sure, my pleasure.
So how can we start our session today? Do we start with what is a healthy lifestyle of a heart?
Sure, we can really talk about that.
Perfect.
Actually, our heart is one of the important organs, or because I am a cardiologist, I see it is the most important organ in our body. And we have to save it as much as we can, because usually if we have a problem in the heart, other parts of the body would be suffering, and also we cannot really treat it perfectly again. You should really try to really adapt a healthy lifestyle. What a healthy lifestyle is to, regularly exercise, go walking maybe every day for 30 to 45 minutes, healthy diet. We should really eat healthy food, not the fast food or junk food, and be away from the salts, and also try to, get food rich in omega-3, which is really a very important component in our food we should really have. We should really be away from the stress. We cannot really say that we can do this easily nowadays, to be away from the stress, but actually if we be away from the stress, actually would be a very good thing, that we save our heart from the deleterious effects of the stress. Also smoking, which is really now getting more and more. People are maybe staying more and more at home, and they are smoking more. So we should really encourage them to stop smoking and reduce smoking as much as they can. This is, just an overview of what we should really do to keep our heart healthy.
Dr. Mohammed, you mentioned the pandemic or COVID times, but this will definitely have a question on it. I just received a live question now from the audience. She says it's a simple question. Working out during fasting, is it good for the heart? And what about hydration for the heart?
Okay. Actually, doing exercise during fasting, we can really do exercise during fasting. There's no problems at all. And if we are doing it in an environment which is not hot, I mean that if you're doing it inside the gym or something, we can really do. And we cannot really go heavy like the normal days, like, do 1 hour or one hour and a half of exercise. We can really do a 30 minutes, like jogging or walking or doing some cardio. Can be done without any problem or any change in the hemodynamics of our body. But you shouldn't really do it in the outside and the hot weather and excessive exercise. This would not be appropriate actually to be done in Ramadan. If you like not to stop your system of doing activities and exercise and so on, you can do it either after iftar or before the suhoor. You can do the exercise, and you can drink water, and will be good.
Yeah, that was my question. Would you recommend running exercises or doing your exercises before iftar while the person is fasting, or after breaking the fast?
Yes, actually, it depends. If the person is really regularly exercising, not starting, then he can tolerate to do exercise before the iftar. But if you're doing it for the first time, I don't recommend that, because is the hypoglycemia. Because in Ramadan we are not eating, and that our sugar level in our body starts the fuel of our body and our heart. This will be a problem really. So it's better if you take a light iftar and go for your exercise. This would be and then come again if you want to take a snack or continue your iftar. This would be the best thing. And actually, it depends. They are fine with that, but actually they are trained to do so. They are doing it all the year, not only on the time of the Ramadan only.
Dr. Mohammed, I think we covered the Ramadan part and exercises. How about exercise in regular days? We hear sometimes that excessive exercise is not good for the heart, and people suffer from cardiac issues from excessive exercises. How can you advise us or tell us what is an excessive exercise and what's a good limit for exercising?
Okay, actually, this is a very important question to answer. The thing is that exercise is good for the heart, but actually, we shouldn't really go off the limits, because actually, the thing is, you should have a personal trainer or a trainer that will know your capabilities, know your age, know your problems, medical problems, because not every exercise is suitable for everybody. For example, for the age also, if you are older, people shouldn't really go for weightlifting or going for exercising heavily more than 2 hours, for example, per day. There is limits actually, and there is some kind of charts and schedules according to the age, the medical condition, and actually the experts of the trainers in the gyms, usually they know what's the limit you should really go. So you shouldn't really push off the limits, because actually if you do more than the normal thing, you will get the reverse.
Yeah.
The things will get really worse. And very important issue also that we have to highlight here, that people before they go and start to go for a gym or exercise and so on, they should really visit a cardiologist at least once. Why we should do so? It's not just for just to check your ECG, do some exercise stress test, which is a test for your capabilities, as your physical activity, your blood pressure, your ischemic status, everything. If everything is fine, you can really proceed. And some of the patients also need to do an echo, because you have heard, sure, about the athletes that die because of in the field, because of they're having excessive exercise. Sometimes they have what we call hypertrophic cardiomyopathy, the echo. So if you do severe exercise or vigorous exercise, this will block the way of the blood getting out of the heart, and the patient will die. So it's better, if you are planning to go for exercise, heavy exercise, you should really visit the cardiologist, check you before, and then give you a clearance that you're okay, you can proceed. Also to the limits that your age allows and your cardiac condition or your health condition allows.
And the tests.
Yeah.
First, how frequently should we go for tests and doing echo, and at what age should we start? You know, with obesity now among youngsters, it's very important to check also their heart, because we don't want to reach to the point where it is a problem that we cannot solve.
Sure, agree. The thing is that really in our daily life now, we see patients who are young, as you have said, young patients coming to us with cardiac problems. So this is a big issue that we are facing nowadays. And actually, most of these things can be actually prevented, or we can protect these patients from more and more risk to happening to their heart if they detect their problem early. Early means, usually it's in the mid-30s, in the 40s, early 40s. We should really start to do so. But sometimes we need to do it earlier, maybe in the early 30s, or even the late 20s, if you have a family history of cardiac disease. What does it mean? People, they have a genetic predisposition for dyslipidemia, what you call the elevated cholesterol levels. You should really do this earlier, because actually, if we wait more and more, this will cause more blockage and stenosis of their arteries. So if we check them early, we can prevent this from happening early and protect them from having MIs or stroke. Mother, your aunt, they have a problem with the heart. Please go and check your heart early as much as you can, because usually it is a genetic thing. The hypertension is genetic, the cholesterol is genetic, the diabetes are genetic. All these are genetic diseases. They are in the person genes. So if you detect it early, you're protecting your heart and your body from the side effects. In the early 30s, you should come to the hospital, check his blood pressure, check his cholesterol, check his diabetic status, and also do some, we call it non-invasive tests. It's not really doing any harm to your body. We're just doing echo, which is an ultrasound of the heart. We are just checking how the heart is functioning, the efficacy of your heart, the valves, how they are functioning, if there's any problem in the valves, the pressures inside your heart. This is very important. Doing also the stress test is very important, because actually stress test will show us if there is any blockages in your coronary arteries, and also assess your functional capacity, how you can exercise, how can you walk, can you run. Check also your response, your hypertensive response, your how much your blood pressure will go up when you do exercise. It's a very important item. So if we check all these things and we found out that it's okay, this means that every year you can really do that. If we found any problem, there will be another actually schedule for that according to the patient age, condition, comorbidities, and so on. So if we treat the risk factors, what we call the risk factors, early, we can prevent any problem happening to
that we would notice and immediately we have to address it to the doctor. What would be those symptoms?
Sure. We want to say that everybody has his own way of life, and he knows his normals. So if you find yourself having any abnormality from your normal activity, for example, if you used to climb 4 stores, for example, without any dyspnea or breathlessness, or this is a symptom. You should really go and see the doctor. Why I have changed? Maybe it's it's something with the age, with your obesity or whatever happens, but you should really check. This is one of the important things. Other thing is pain. We really look at the pain very, very, very strictly. Any person who is having any chest pain, either it is coming from the heart or coming from other place, we should really respect it.
Can we have a stress point on this one, please, about the pain? Because
Sure.
Sometimes you say, I have a chest pain or a pain around the chest, but because I slept, in a different position, or I did I have a muscle strain.
Sure.
And we can give so many explanations for that away from a stroke or a chest pain.
I agree. The thing is, chest pain is a very respected symptom. We should really, we are as cardiologists, respect the chest pain. Either it is from the heart or it is from other source. We should really investigate and be sure. Like, the stress test, CT coronary angiogram even. We do echo, we do what we call the cardiac enzymes, we check for the risk factors and all these things. So if you have a chest pain, do not ignore it, because if you ignore it, there is a blockage in the arteries. If it stays more than 6 hours, actually the part of the heart will be destroyed, and destroyed forever. This is the main thing. So if you go early, if you have a chest pain, within an hour, for example, you reach the hospital, you took the medications, everything will be fine, will be no damage. But if you just ignore it, say, oh, it's a stomach, it's gases, it's muscles, it's, I slept on this side, all these things, and it came to be a cardiac problem, it would be really. But if you go to the hospital and they found out it is gastric, it is whatever, it's fine. Absolutely. You didn't lose anything. You checked your heart, you checked yourself, you are fine, everything is okay, you can go home safely, happy, no problems at all. But if there is a problem, you will be treated immediately, and you will take the medications that will protect your heart from any further effects happening to the cardiac muscle. Early detection. Absolutely. So the chest pain for us is a very, very important symptom. Patient with a chest pain should be really respected, and his pain should be respected, and you should really be treated immediately.
I'm a Dextrocardia. I need to check up after the age of 35. And any restrictions for exercise?
Actually, Dextrocardia is on the right side. It's, our heart main is in the middle of the chest, but it's inclined more to the left side. The apex of the heart is here. So here, the other side, it is the different side. It is the apex is in the right side. It's a congenital thing during the development. You can live normally. They usually they have no problems at all. They can live their life normally, but as long as they know that they have this thing, because if they go someplace and they do an ECG, for example, the regular ECG, we put it on the left side, it will come different. So they should really check. Tell them that we have a Dextrocardia, so they will put the ECG leads on the other side. This is one thing. And they can live their life normally. They have risks like other people. There is no increased risk of any problems if they are Dextrocardia. They are just like other persons. They can, whatever happens to the people with the levocardia, which is the normal side, happened to.
A question on the pandemic and how we're living in this
Sure.
time and difficulties with COVID and this pandemic. If someone a special treatment for them?
Yeah, actually, the people we have many patients that came to us with after the COVID. They are usually our regular patients. They are following up with us either with ischemic heart disease, hypertension, cholesterol, and so on. And they got COVID, and they took the medications for the COVID. Actually, medications are just some vitamins like vitamin C, vitamin D, zinc, and so on. Even the antibiotics are Panadols and things which is safe with our names, but the Cataflam, the Voltaren, the things all like that is not good regularly for the heart if you take it regularly for the heart. Anyway, but actually in those patients, if you have COVID and you are having heart disease, usually it depends on your condition. For example, if you're taking an antihypertensive and your blood pressure is due to the COVID and due to the state of the fever and so on, the blood pressure drops. So the blood pressure treatment will not be appropriate for you. You should really stop the medication and consult your doctor. But regarding for example, the antiplatelets like the aspirin, the Plavix, and so on, they are okay because actually usually in case of COVID, we are giving also anticoagulant to the patients. So it's fine if you take with the heart, except some of the antibiotics that you really should consult your doctor because if you have kind of arrhythmias and so on, you should really consult the cardiologist because they are inducing arrhythmias. Otherwise, it's normal. But what is happening after the COVID? Usually, some of our patients, they will inflammation on the pericardium around the heart, yes. And also sometimes, because COVID actually, it's a very, very tricky virus. We cannot really know what's doing. So some people, it affects the hearts too. Affect the myocardium, which is the pumping action of the heart starts to be impaired. So I recommend that patients with cardiac disease, they should really follow after the COVID. If they get COVID infection, should really check the heart again, check if there are any problems, any change of their pattern of life or pattern of the disease. You should really come and review, and we can modify the treatment.
So I have a family history of cholesterol. So how frequently should I run the test, and are there any tests that should be done along with a lipid profile?
Sure, this is very, very good question, and very, we really want to elaborate on this part. Cholesterol is very, very dangerous component in our body. Dangerous and also essential. Cholesterol is a product of our body that we use to produce hormones, and many parts of our body we use the cholesterol in our body. But actually, excessive cholesterol is a problem. Not the cholesterol by itself, but the excessive cholesterol. We have some people with genetic changes in their body that will induce the more production of the cholesterol in their body. So the organ that is responsible for the production of cholesterol is the liver. So if we have excessive production of the cholesterol, there is no way it will go except it will go in the bloodstream and starts to deposit inside the arteries. Not inside means the inner layer, but actually it diffuse through the wall of the arteries and deposit in the layer below the surface, okay? So it will push the artery wall downwards. So it makes the heart and the arteries of the hand or the legs, but in the small arteries like the coronary arteries or the brain, actually there will be a problem because they are already small arteries. So if we deposit the cholesterol inside this, which is happening over the years and years, we have an early atherosclerosis, means early stiffness of our arteries, and this will end by we should really start taking the medicine for the cholesterol at a younger age. According to the guidelines, we can start taking the medicine for the cholesterol at the age of 21. So you can even if you can check your cholesterol. If it is high, start taking the medication for the cholesterol, and you have to keep taking the medications for life. This is something that we should really stress upon it, because people, when we do them the cholesterol, it is high, we give the treatment, and they continue the medicine for 1 or 2 months. They found their cholesterol is good. They say, okay, we are cured. We'll stop the medicine. And they stop the medicine. And this is very, very big mistake, because we never get cure from the cholesterol. As long as we are taking the medication, we are keeping actually our levels of the cholesterol in the normal or the goals. We have goals, international goals for this. For example, We like the LDL, which is the low density lipoprotein, to be below 100. This is a very important thing. So if we reach this goal, we should really keep the treatment going on, not to reduce the dose and not to stop the medication, because we see this frequently. Then you stop the medicine. This is very, very, if you do so, you will prevent yourself and your heart from any problems in the heart, inshallah. By actually, we have many trials about that, reducing the mortality and morbidity about 30 to 45%. So this is a very good thing.
Absolutely.
As long as you're taking the medication.
Okay.
So this is very, very important part.
Doctor, honestly, I don't want to end the session before I touch point on pregnancy with heart issues.
Sure. Okay.
If you can tell us more, what's the complications, but in a way that we definitely, we don't want to scare them.
No.
But it happens. We have a lot of patients who are pregnant with heart issues. How can they deal with it?
Can check her heart beforehand, before she gets pregnant, and assess her cardiac condition, especially if she has a family history of cardiac disease or hypertension or sugar or cholesterol. And sometimes we see in the younger population there is problem in the valves, some kind of stenosis or regurgitation. Assess and at least know the condition of the patient beforehand. So when she goes to the pregnancy and almost coming, usually we see the pregnant ladies coming with hypertension. And we have medications, which is usually safe to be given to the ladies. We can really treat it by medication, or sometimes if we need, which is rarely we do, we need some kind of special precautions or some intervention, which can be done also easily without any. But the best thing is that we should really check early, detect. This is usually what we always advise our patient is to prevent things from happening. We don't want to wait until the problem happens, then we go and try to fix it. No, we have to really see it forehand, and then we proceed for the management early, so we don't have any problems in the later time.
Sure. Doctor, towards the end of our session, how can we wrap up our session in 5 important tips that you can share with our audience?
Sure. Okay. So, my dear audience, actually, I'm very happy to be with you today, and it was very interactive session. I wish you that you have a healthy heart all the time, and to keep your heart healthy, you should really try, as we have said in the earlier in our talk, that you should really be away from the stress as much as we can. We try to exercise daily as much as we can. I know that sometimes the time is not convenient, but try even for a walk of 20-30 minutes. And it should be a brisk walking. If you like to walk, you should really walk a little bit quicker. Okay. You should really adapt, healthy lifestyle in the food. The diet you should really eat should be, away from the heavy meat. We can say that the red meat is not really our friend. We should really go for the light meat like the fish, the chicken, which is really a good source of proteins. Vegetables, fruits, nuts, which is raw nuts. This is very, very important source of diet, and for the also omega-3, which is very protective to the heart. We should really be away from the smoking as much as we can. Try to reduce the smoke as much as we can, and even the use of this new device. If I'm using this, I'm really away from the smoking. You are actually also have the same thing. Yeah, parts of or components of the smoking is not there, which is the carbon monoxide and also the paper which is being burned. But actually there is nicotine, and nicotine is very bad, and actually it affects our heart in a very bad state, because actually it blocks the arteries. It causes what we call a spasm of the heart. So if we do so, and the most important thing is also to go for checkups, as we have discussed now, that we should really go for checkups as early as possible, and continue doing so on a yearly basis if we can. This is how we can really protect our heart and keep it healthy all the time. And thank you so much for your interest.
Thank you so much for being with us and answer your questions. Thank you so much to Dr. Mohammed Fathi, specialist cardiologist at Medcare Sharjah. Thank you so much for your time, and thank you for answering most of the questions that we've received. Until we see you next session, take care and stay healthy.